All right. Can you see my slides?
Yes.
Okay. Excellent. Well, thank you so much for having me. I'm really excited to be able to share some of what I do for a living with everybody. I'm sure you guys are all in the same wavelength. You have learned and trying to study integrative herbal medicine from varying approaches, hopefully. And that is actually my goal for today. So like John said, I'm in clinical practice, and primarily I am a clinician. I do teach herbal medicine, but I see people all day long. So I see I would say about 80 patients a week, and probably 2/3 of those people are on some form of herbal medicine. And within any one day, I will probably use every model of medicine that I've studied each particular day. So what I decided to do for today's lecture is I wanted to try to inspire you to broaden your way of looking at clients, at herbs, at just energetics and medical models, and maybe take little tricks from a model that you don't know to add into your toolkit. So the 5 systems of medicine essentially that I use, like you said, I'm a nurse practitioner, so I do use allopathic medicine, although I will say very, very small amounts of it, because I'm not really into medications and drugs except for as a very last resort. I am an herbalist at heart. Absolutely. That is my primary goal in life, is to get everybody to use herbs and healthy diets and food as medicine. I did study functional medicine, and so I do integrate that. We'll mention some of that. I use Ayurveda quite a bit. I use Chinese medicine. My doctorate is in Chinese medicine, so I use that quite extensively. And I'm trained in Western herbal medicine as well. I don't know Nani Tib. I don't know the Greco-Roman traditions specifically. Hopefully in the future, I'll get to study those. So with that said, my goals for today, I want to talk to you about what SIBO is. And I'm trying to keep it as succinct as possible because we're covering a lot of ground. So, buckle up. We're going to go through a whirlwind of information. And if you know how to screenshot some of these slides, that would be a good idea. And I would encourage it. I think it's great. I want you to have this information because you're going to have more information in this lecture in 45 minutes than you're going to be able to absorb. I guarantee you. So screenshot whatever you can. And there will be recordings, of course, so that you can go back and get more of those screenshots. And I want to give you some different systems of medicine. And really what I want to do is to inspire you to go out and learn some more. Okay, so for anybody that's practicing or learning in this online classroom, one of these modes of medicine may be something you practice. You may be an Ayurvedic practitioner and have a good grasp of that. Ayurvedic model of what I'm talking about will be very, very, very basic. But what I want to do is try to get you to learn different things and not just focus in on the perfect, prescriptions from each of the particular models. We're going to try to bring it all together. So let's dive right in. So SIBO is small intestine bowel overgrowth. It's also called bacterial overgrowth syndrome. So if you're doing any research and doing a literature search, you can use both search terms to get information. It's good to know that. I stumbled across that myself when I was doing a little deep dive for this presentation. And essentially, it's the normal GI flora gone wrong. Okay, so what normal means, you'll see in these bullet points. Typically, from mouth to anus, we have a greater quantity of bacteria as you progress down the digestive tract. So we have the fewest number of bacteria in the mouth, more in the esophagus, more in the stomach, more in the small intestine, and the most in the large intestine. That's in the normal environment. When someone has SIBO, something has gone wrong for whatever mechanism of action that we will, whatever pathology that we'll see in the next few slides, that the small intestine has an abnormally large burden of bacteria. So these gram-negative anaerobes and gram-positive anaerobes that typically live in the large intestine often will back up into the small intestine where they don't really belong. And when you have a bacterium that lives in the wrong environment, it starts to set the environment off and create dysfunction within that environment. So these, anaerobes in the small intestine start to cause breakdown in the small intestine and change digestive juices, et cetera. So that's what causes the symptom picture at the most simplistic level, but that's what we're trying to figure out how to rebalance and fix so that these people can feel more comfortable and have more optimal digestion. So what the next couple of slides, I'm just going to tell you, I called them SIBO associations. And I did that intentionally because there are some of these bullet points that we could identify, oh yeah, that's a particular cause. But there's a lot of debate in the literature about a few of them, where is it the cause or is it the effect? And we're not 100% sure. The interesting thing about SIBO, when you start to do research on it from a Western medicine, allopathic or scientific perspective, we know a lot less than we think we know. Every time I follow a thread of research, I tend to hit a dead end. And so that's why it's nice to be able to put this together from different perspectives, because where the dead ends go scientifically, we have ancient medicine to help us out. So primarily, the main thing to think about are the symptoms. It's discomfort, bloating, cramping, gas. That is absolutely the number one symptom that I would say all SIBO patients have in common. How it manifests after that can be a little different from person to person, but that is the big commonality. So you can have no bowel changes. Some of my SIBO patients do not have bowel changes at all. They have normal formed stool, once a day, easy, etc. But the majority of them, I would say, will have either constipation or diarrhea. And there is talk in the literature of why that happens, and that there is a bit of a dichotomy between hydrogen-producing bacteria, which will tend to create more of a diarrhea situation, and constipation, which is produced often more by the methane-type producing bacteria. Now, here's the thing. That's not always true, and there's often people that have both diarrhea and constipation, so we can't really make that a rule, and the research is still out on that. We're going to start, we have to keep learning as this disease becomes, or this syndrome kind of becomes more researched over time. So we do know that it is associated with hyposecretion of gastric juices, our gastric HCl, our pancreatic enzymes, which are the things we need to digest our food, and those things also keep bacteria in check. So here's one of those chicken or egg situations. Was it the HCl hyposecretion, the underproduction of gastric HCl, that caused the bacteria to overgrow in that environment? Or something else happened where the bacteria started overgrowing and then encroached on the function of the stomach? There are different opinions out there, actually. The majority of people will say that it's the first one, where we had low stomach acid production, therefore the bacteria overgrows, but I have seen diverse opinions on that. Either way, we do know it is absolutely associated, which is why I call the slide SIBO associations, and it warrants our attention as clinicians. We have another issue with anaerobes, the anaerobic bacteria that back up, especially from the large intestine. They deconjugate bile acid. So our bile from our liver and gallbladder just stops functioning properly. So again, you have fewer acids, fewer things that are preventing these bacteria from growing, and it becomes a really happy environment for bacteria where it shouldn't be happy on a normal circumstance, and then the bacteria starts growing. Sometimes yeasts as well, and causing some of these symptoms. Now, the next thing is the bacteria starts to cause, they of course die off, and anytime you have bacterial die-off, you have various types of metabolic toxins from die-off, and also metabolic toxins from them being alive and metabolizing whatever, the food. They have input, they have output, just like Ayurveda will say, we have input, we have output, so does each bacteria. And that output of a bacteria, whether it's alive or when it dies off, is a toxic metabolite. Often there are some beneficial ones like vitamin D and B vitamins as well, but a lot of times it can be toxic. That can cause mucosal breakdown, which leads to what people call things like leaky gut. So just for those of you who don't know that term, leaky gut essentially is talking about when the cells in the mucosal layer, which are normally held together with a nice tight pressure. So you have two different cells, they're held together, and the pressures in the tissue keep them held together. Well, and there's some proteins in between that also link them, keeping them a nice solid barrier. Well, leaky gut happens when the inflammation is constant, those proteins start to break down, the pressure system changes, and now things that were in your intestine that should not pass that barrier start to leak into the bloodstream, and now it can go systemic, and you could have systemic effects. So the next bullet point, you could have immune reactions. So our body now sees some of those toxins and those proteins leaking in as foreign invaders. So that wreaks havoc on our immune system. We get histamine responses, which is histamine is like an allergic type response, and other types of interleukins that climb and with the inflammatory infiltrate. So you can get, of course, the gut lining becomes inflamed and irritated and ineffective, but we can start to see symptoms become systemic, like brain fog is a very common one that I see because our nervous system is very much susceptible to these toxins. We can get skin rashes, joint pains, a whole host of symptoms, and those could be individual. So I can't say a complete list. I've seen all different kinds of things. You have another problem where those lining causes dysfunction with the enterocytes, which is where we absorb our nutrients. And so we essentially get malnourished. Even though we could still keep eating, we're not getting the nutrients we need into the bloodstream. So bad things get into the bloodstream. The things we want don't always get there. So we're disrupting just the whole system. We also could have, because of that, unintentional weight loss. So obviously, if you see a client, that's always a red flag, something like if someone loses 20 pounds in a month or two without trying, they're not trying to lose weight, it just accidentally happens without them knowing, that could be a red flag where they need to be evaluated for other things that are maybe even not SIBO. But SIBO could be one of those causes, although it's usually not as dramatic as 10, 20 pounds in a month. It's a small and slow weight loss. So other associations are anatomical defects. So you have a list there with like megacolon, and which is a genetically large colon, and diverticulate are outpouchings of the intestines, and various types of things like fistulas where the intestines bind together abnormally. And so the intestinal anatomy is not working properly, and we can't necessarily help that as much as herbalists. That part is more of a surgical thing, but just to know that this could be a potential cause. If the intestines aren't working properly, things can back up and SIBO could develop. So we could help them really well with the SIBO and all the other associated symptoms. But if they do have this as a cause, it may be a surgical correction that's necessary for full recovery, if at all, if possible. You could have something like a valve issue. So the incompetent ileocecal valve, which is where the small intestine and large intestine meet each other. There's a valve there to prevent the food from backing up and the waste products from backing up to the small intestine. There are possibilities where that valve becomes dysfunctional and things can back up. That's another thing that's a little difficult. It's a little structural, but we could do that, help it with healthy diet and herbs and correct peristalsis. 2/3 of cirrhosis patients have a SIBO. And again, this is one of those which came first, we don't really know, but they are definitely associated with each other. And there is an increased risk for other people that have immune disorders, celiac issues, alcoholism, anything that could disturb the immune and gut reactions. So I'm going to talk about peristalsis very, very briefly. So this is interesting. We've heard about the enteric brain. So hopefully, if you haven't, I'm going to just briefly talk about it. So we have nerves that go from the brain to the spinal cord, and then those nerves eventually branch out to all of our different organs that help tell our organs to function, to stop functioning, to send sensory nerves that give us sensation from the organs, etc. So there's a whole host of them. And this first slide is what we call extrinsic innervation. So that's exactly what I just mentioned. The nerves that come from the brain, which is our master control center, to tell the organs what to do and function properly. There could be a problem with one of those nerves. And this is not something you'll see in the literature. This is more of an osteopathic perspective and a body worker perspective that I have. But if you see someone and those nerves that go to the small intestine are from approximately T6 to L2, somewhere around there, if you have someone with chronic back pain and these GI and small intestine disturbances, it would behoove us as herbalists to treat the structure as well as the organs in order to be holistic, of course. So it would be worth addressing the actual back pain, whether you send them to someone who does a structural work like chiropractic, acupuncture, osteopathy, physical therapy, etc., or use your knowledge as herbalists that you with topical herbal medicines to help, pain syndromes, topical oils, etc. But it would be worth addressing if you see that kind of issue. Then we have intrinsic innervation. So this is the enteric brain, where we know that if we cut the intestine, and there have been lab studies that have done this over the years, if you cut the intestine off from its nerve supply to the brain, the intestine still functions. You can actually still see peristalsis, which are the wave-like contractions that propel food and waste through the intestines. So we know that the large intestine is the only organ that can actually do this. When any other organ that's cut off from the rest of the body or the brain, it stops functioning. We know that the intestine has its own intrinsic pacemaker neurons, which are sort of like the pacemaker in our heart, which tells our heart to beat. Well, our intestines also have pacemaker neurons. Those are called the cells of Kajal. And those have their own rhythm to help encourage peristalsis. So I will say this is a very complicated system. We have nerves that are in the lining of the muscles, or inside the muscles. We have nerves that are in the lining of the lumen of the intestines, an incredibly complex system. Now, here's where, when I did my deep dive into the neurology of peristalsis, I hit lots of dead ends. And the reality is we end up having more questions about this whole system than we have answers. And the neurology is also constantly changing. So can we make any major judgments about this from a scientific perspective or implement treatments? Maybe not quite yet. We have some things we could think about. That's about it. So that's what I wanted to give you here. And if you are interested in really diving deeply into this, the article I cited here of Spencer and Hu is a really great article. It's super intense, so you have to really want to learn some neurology to get through it. But I will just mention the term migrating motor complex. So these are waves that are coordinated waves of electrical activity. You will hear a lot about this in SIBO if you're doing any research, because we think that a big component of what happens in SIBO is a discoordination, where these nerves are not working properly. You know, instead of pumping the intestine in a sequence, they start to become erratic. So the movement of the small intestine is not working properly. Now that helps, you know, the situation progress where bacteria can back up. One thing we do know is that the migrating motor complex does activate in a fasting state. Now, we can absolutely take advantage of that as herbalists, because we can teach people, just like the ancient medical systems always say, we should eat 3 consolidated meals or 2 consolidated meals. So for people with SIBO, it's very likely that snacking is a really not a good idea. So we can help reestablish that peristaltic rhythm if we simply have rhythm in our life. Wake with the sun, as the ancient textbooks tell us, go to bed with the sun, eat those 3 meals at regular times. If you eat breakfast at 7:30 a.m., always eat breakfast at 7:30 a.m. That rhythm becomes established because of our behavior. And there's another couple things. There are a couple diseases that also can cause abnormal peristalsis. So I just wanted you to know that they are there. They're, you know, things that we have to also look for when we're investigating SIBO, and rule out those other causes or treat them additionally. Neurotransmitters, we used to think that serotonin was a big part of peristalsis and caused the intestines to work properly. That has now been dispelled. We don't think that it is the cause of peristalsis, but it is a modulator of peristalsis. So serotonin, yes, is involved, but, you know, will taking St. John's wort, will that help our intestinal peristalsis? There's a question mark. I don't have an answer, and more research in the future hopefully will come out to give us more of those answers. But we know that there is some involvement in regulating that activity. We just aren't sure exactly yet, at least so far. There's an interesting study here. I like this one a lot, actually. It's a small study, 120 subjects. They put 3 groups. A healthy group is, I guess, a control, a SIBO with constipation, and a SIBO with diarrhea group. Oddly enough, all the SIBO patients were diagnosed with either anxiety or depression on some level, which I find a little bit odd, but there is a correlation there for sure. The point of this was they gave them rifaximin, which is one of the most used antibiotics specifically for SIBO. And all of the people with this antibiotic that had SIBO experienced better tryptophan metabolism, which tryptophan is in the chain of serotonin production, and their mental health got better. So we do think, because of this study and some other things, that there is a relationship with neurotransmitters, with depression, et cetera, but what exactly we can't quite nail down yet. But in the future, you may be able to use some herbal tricks as we learn more about that. So testing, what do we do for testing? We have hydrogen and methane breath testing, where they breathe into a tube, and then we test for these gases over several hours to see the preponderance of those things. The gold standard is a jejunal aspirate, which a GI doctor goes in with a scope, takes a little bit of a sample, and then they culture it. That's a gold standard, but there's a lot of problems with that as well. They could miss the sample or get the wrong sample, or things could get contaminated on the way out, for example. And you also have fecal microbiome testing, where we take a stool sample, and there's various companies that do good tests like that, and they basically map out what species of bacteria are growing more or less, and so you can get a sense for what the microbiome looks like. So all of these have their pros, all of them have their cons, and we absolutely know that none of them are perfect. So that's a big debate. And so if you want to learn more about that, there absolutely are ways to learn and easy things to research. So I'm not going to go into more detail because I want to get to the stuff that is harder to research for us herbalists, which are the herbs. Allopathic treatment consists of rifaximin is the main, and then there's a whole host of medications. Metronidazole, which is Flagyl, is often used, and sometimes these things are used to just debulk the actual bacterial quantity. Sometimes they're used at pulsing. Various people will use them different ways, but as herbalists, we think about these things and we say, yuck, we don't want to put antibiotics into the system. We have possible better ways of doing it more holistically. Then we have things that stop diarrhea, things that are prokinetics that help motility. And of course, they might, if they're lucky, you get a good physician, they might say, yeah, well, let's give you some nutrition and give you some diet therapy. But even then, only maybe, because we haven't found any good diets in the research from a Western scientific perspective. So that's basically the kind of approach, which is basically a subpar approach. This is not really helping a lot of people, unfortunately. For us, it's fortunately, because that gives us a good job as herbalists, because we can help people often more than the drugs. So if you want to learn more about those concepts, the testing, the diet therapy, things like that, the medications, this citation here by Pimentel is from the American College of Gastroenterology. This is the most up-to-date Western allopathic algorithm for SIBO that I was able to find. So you could certainly read that yourself and get more information if that's interest to you. So now we're going to move to my next one, which is functional medicine. I studied with the Institute of Functional Medicine and researching on my own as well. I did lots of studies. So it holds a special place in my heart. I wouldn't say that I use it very specifically, but I think I learned quite a bit from the functional medicine approach that I actually do integrate into my herbal medicine. So the functional medicine, now, I can't teach you a whole modality, but I want to focus in on the 5 R's. So this is something you've probably heard. It's pretty popular. This is the approach to the microbiome and the GI tract in a broad umbrella perspective. So they're the 5 R's of the microbiome. So the first is to remove. And so here what we're talking about is removing the problematic bacteria, but using some sort of antimicrobial, whether it's Xifaxan, a drug, whether it's using an herb, which of course that's where we're going to talk about more, or what have you, or diet therapy, et cetera. But the concept is we have to take away the bad guys. We have to kill get rid of the army of the people invading. Then we have to replace. Now, what we're replacing are the things that our body is not producing effectively. So we know that our gastric secretions and our pancreatic secretions are not adequate to keep the bacteria in check. So the functional medicine model teaches us we should try to replace stomach acid or increase it. Well, if we're not able to do it intrinsically, we can give it exogenously. So you could use things like betaine HCl, which is an exogenous form of acid. You can give digestive bitters, which of course we herbalists love those things. That's my preferred method, which we'll talk about later. You can give pancreatic enzymes directly. You could use apple cider vinegar, ox bile, which I personally never use. I'm not a fan of the animal acids because I think they're just really, really harsh. Amino acids like taurine, which help bile production and thin the bile to make it more fluid and flow into the intestines. Then we have to re-inoculate. So we want to bring the good bacteria back into balance. Of course, with SIBO, this is a tricky thing because SIBO already is a good bacteria overgrowth. It has overgrowth of bad, sometimes the stuff that shouldn't be there, but it also could just be a simple overgrowth of the stuff we like. So I will say with SIBO, you do have to be cautious about using a probiotic. And often in my experience, I will start them on some sort of an antimicrobial protocol, get their GI function working a little better first for about a month or two. And then I'll start to add the probiotics in because if you add it too soon or too aggressively, you might actually make their bloating symptoms worse and they'll be not happy with you because they'll feel more discomfort, which is what they're there for. So you could give them probiotics or prebiotics. Prebiotics are what, like one of my teachers says, it's like miracle grow for our intestinal flora. So it's fibers that are like inulin, which come from things like chicory and Jerusalem artichoke roots, arabinogalactans, which are supplements you can buy that are extracted from the Western, I believe, the Western larch tree. So there's a number of ways of doing it. So you're putting the actual bacteria back in with a probiotic, and then you're giving them food with a prebiotic so you can actually bring them into life. Repair is specifically talking about the GI mucosa. So we're talking about marshmallow, slippery elm, L-glutamine, all of the things you see in the slide, DGL licorice, whole licorice, of course, works, things like quercetin, okra, which is really slimy and slippery and gives you that mucilaginous content for the intestines. Zinc carnosine helps with it, omega fatty acids, colostrum, Saccharomyces, which is a yeast. So there's a number of products we can use for that aspect. The only other note I'll make about that before we move on is that slippery elm is often over harvested at this point because it's so popular. So we are encouraging people to try to come away from the slippery elm and use things like marshmallow instead, because we can get marshmallow and grow it really fast, whereas elm trees take a long time to grow. And then finally, rebalance, which now we're talking about the rest of our lifestyle. Sleep better, reduce our stress, eat better, drink water, etc. Get some exercise. So that's essentially the functional medicine theory. And we could apply various systems of herbal medicine within there, which is nice that we have an overarching paradigm to think from. Diet therapy, we have FODMAP diet. Again, fairly controversial. There's not much research, or actually, I don't think there's been any research really showing that the FODMAP diet works for SIBO. It was originally developed for IBS. With that said, my opinion is that I think that any diet could be useful for a person, and you really have to try it. You give it a shot, see how it works, because we're all so unique, we're so individual that research doesn't always tell me everything. I like research, but it has its limitations as well. Gluten-free diet is another one. They say that the research says there's no good evidence to support its use. I've seen it help people tremendously. So again, I don't always believe the research, and I try with people, as long as we're not doing harm, then why not give it a shot? So let's move on to our first energetic model, Ayurveda. And so, of course, for those of you who are Ayurvedic practitioners, this is going to be incredibly, incredibly basic. For those of you who are not, this might be really interesting and you'll learn some new tricks, but we're going to put all of this in our tool belt. So Ayurveda, one of the main diseases that, of course, there's no Ayurvedic text that tells us here's SIBO, a disease, and how we treat it. Because, 2000 years ago, in the times of Sushruta and Charaka, there was no such thing as SIBO. This is a modern understanding. So we have to use our critical thinking, just like the Vedic texts tell us that a physician should have good logic, use the good, strong logic. And if we don't have good logic, we probably shouldn't be practicing as a physician, according to the Vedic texts. So we want to develop that logic. So we're taking a disease with a modern understanding, and we have to try to approximate it with the classical diseases from the Vedic texts. So the one that I think of the most, or absolutely the fastest, is Grahani. Grahani is essentially a malabsorption syndrome that was described by the surgeon Sushruta, and it's said that it exists between the stomach and the large intestine, and it's the site of the Pitta Dara Kala, which is the Dara Kala, or the membranes that hold pitta within that particular organ. So when you look at it that way, you're starting to think, oh, the small intestine mucosa, wow, that sounds a lot like what we're talking about from a SIBO perspective. So maybe there's some correlation here, and we could use this approach to start benefiting people with the SIBO disease. So that's what we're thinking for now. We have the maximum digestion occurring in the small intestine according to the Vedic perspective. There's quite a bit of it that happens from a Western perspective as well. And the thing that goes wrong with this Pitta Dara Kala, or the function of the small intestine, is the Jatara Agni. Jatara means stomach, Agni means fire of digestion. So the metabolic digestive processes, now they weren't particular about any one organ in Ayurveda when you say Jatara Agni. We're really talking about the sum collection of functions of gastric HCl, pancreatic digestive enzymes, liver and gallbladder secretions. All of that together is part of Jatara Agni, which helps us digest and start to metabolize and break down our food. So that's what we're talking about here. And our lifestyle can be not so great, and that can cause problems. So here's some of the traditional causes, and you'll notice too much water with food. I'm sure we've heard this a lot in our Ayurvedic classes, where you dilute your enzymes. Eating the wrong foods, eating incompatible foods, eating irregularly. Well, now that makes us think about that peristalsis comment we talked about, where fasting state enhances the motor complexes of the intestines. So regular eating. They have this thing about suppressing urges. So if we hold our urine or hold our bowels, that can contribute to things backing up and not functioning. Irregular sleep. Emotional disturbances. This in Chinese medicine firmly agree that most diseases have an emotional component at its root if you look far back enough, etc. So healthy lifestyle is what we're looking for, and these are some things we want to avoid, of course. And then we talk about the doshas. The doshas are the functional imbalances that we're primarily looking at. So for those of you who are not Ayurvedic practitioners, I use these words not so carefully, I guess, but it's very hard to translate these concepts. But we could probably all understand that vata seems a little bit like wind, and wind is a little bit as close as probably we can get in the English language context. For those of you who don't know the words in Sanskrit, pitta is sort of like a fire type energetic imbalance. Kapha maybe more like a phlegmy type. So I know that I'm grossly simplifying that, but bear with me for our purposes here. So we have different types of grahani. Here is the list of symptoms. And, obviously we're not looking for someone who has every single one of these symptoms. We're trying to make the best match that we can for the person in front of us, trying to approximate so we could really start to understand the biocharacteristics, the energetic imbalance, because SIBO is not a disease. So if someone looks like what you're seeing on the screen and has some things that are similar, like bad tastes in the mouth, starting to get weak and emaciated, abdominal distension, maybe feeling a little depressed or brain foggy. These are things that have a vata or wind type association. So you might gravitate towards looking at that imbalance and looking for treatments from that perspective. Then we have the two here that are pitta, the fire type, and the kapha phlegm type. So the pitta type, the fire type, you'll have fiery symptoms. And this is common, I think, in most energy-based systems of medicine. Yellowish things are very fiery. So if you have yellowy feces or yellow in your sclera and your skin, you have acidy burping and maybe like regurgitation. Those are fiery symptoms because acids equal fire as well. Phlegmy type or the kapha type, you're going to have that full nauseous kind of fluidy sensation where you feel like you're a water balloon ready to explode, and sticky sensation, sweet taste in the mouth, feeling heavy because it's like you're walking through a swamp. That's what kapha is. It's that watery, muddy kind of murky water. So that could be a person with those types of symptoms. Now, in real life, or at least in my clinical experience, is the last one, which is Sanipatika, which means the three type, the triple type imbalance, which means there's involvement from all three of those imbalances. I find that this is actually one of the more common ones, and the primary cause are metabolic toxins. So we'll come to that in the next slide. But one of the key features is the cyclical nature, where you have a symptom like every day, but it's not there all the constantly, or maybe every day. Classically, it says every 10 days, every 15 days, every 13 days. You don't have to take that literally, but where you're looking as a cyclical nature of the symptoms, and really a lot of SIBO people have that cyclical nature where the bacteria grows, then it calms down, then it grows, then it calms down. So we might start thinking the Sanipatika type, the three imbalances. Then we have ama. Ama are metabolic toxins. So if our stomach is not working properly, the food that we put in does not get transformed, and it becomes something that's unhealthy to the body. So here you have a bunch of symptoms in a list. So of course, you could always study these later. You don't have to memorize all of them. We can't get through every one of them, but you're talking about more heavy, slow, feeling tired. Again, maybe some brain fog, the gas and bloating. You might have some mucus or whitish stuff in your stool. You might have joint swellings and pain around the body. So it just starts to, your body starts to become toxic, and the healthy flow of energy becomes obstructed. So that actually could lead to a whole host of collateral damage. And one of the things I want you to look at or think about, just to keep in your mind, if you think about ama in the small intestine, you might be able to make that parallel between the Western concept of dysbiosis. or biofilms. So biofilms are when bacteria secrete this slimy layer to protect themselves so that things can't kill them off, like our stomach acid or antibiotics, which is one of the reasons why many methods like drug method treatments are often ineffective. They secrete biofilms that protect them from the drugs. So nice thing is that herbs can often treat biofilms better than Western allopathic medications. In fact, I believe there's a bunch of research on that. So we have got some great tools for that. So here's a few herbs. Finally, we get to start talking a little about my favorite topic, which is the herbs themselves. So traditional remedy, buttermilk. And if you're talking about buttermilk, there's a recipe for you. You could do something like 1 part yogurt, 2 parts water. Some people will change the ratio. You blend the heck out of it in a blender with some digestive carminative spices that help the digestion. And then when the fat comes to the top of the liquid of the blender after several minutes, you skim the fat off. Now you have this light, watery liquid that just is good probiotics and helps the digestion without burdening it down because of the fat content. Also, this is assuming you have some good fresh homemade yogurt. Of course, you want good quality live yogurt. And a few herbs. Now, I could go on for days with herbs from each of the traditions. So I just picked a few that I personally use the most frequently and that they're also easily available, because one of the problems with Ayurveda, unfortunately, is availability. We could talk about all these wonderful fancy herbs, but many of them are not available in the US or only available in traditional formulations, not as individual herbs, but these are generally available. So pomegranate, and I've listed some basic energetic qualities for every herb on this presentation so that you have for your reference. The nice thing about it is it's loaded with tannins. Now, tannins are very astringent. And so you could think about using pomegranate, especially if you have more of a loose stool type diarrhea, and they bind to toxins in the gut from a Western or an Ayurvedic perspective. And ellagic acid, which is a very strong antioxidant that's anti-inflammatory. We all know our friend cumin, which is a simple spice that we can make teas of. It's really great for just getting the stomach fire going and strengthening the digestion overall over a long period of time to help the organs themselves. And one of my absolute favorite antimicrobials is neem. So Azadirachta indica, it helps with pitta. So it's really great for people that have that fiery type imbalance with the reflux and, the sour taste in the mouth, etc. Not to say you can't use it in the other types. So you just have to change the balance of your formula. But if you have those, especially those fiery type symptoms, this should be one of the first herbs on your mind. It's a broad spectrum antimicrobial. It's been shown, and you see some literature on this slide that we found. Of course, a lot of it's in vitro and some animal studies. There's not a lot of great human studies with herbal medicine yet, but we're getting there. But there is research showing it inhibits MRSA, which is really hard to kill with anything. Because it's multiple resistant Staph aureus, it's multiply resistant to many different drugs. And it kills MRSA biofilms, actually. It helps with those. It even helps with schistosomiasis, which are worms that are really rough to kill. So anything that can kill a worm is going to be really effective as an antibacterial, because bacteria aren't quite as difficult to kill as something like a worm or an amoeba. So we see it kills many different things: Staph aureus, Enterococcus, Pseudomonas, etc. It also helps heal gastric ulcers. So it helps with drying a little bit of the secretions that could instigate ulcers. So we could also think of this as a mucosal healer on one level. It's also a source of antioxidants, which is something that's not very well known, but neem has a good load of antioxidants that are anti-inflammatory and help with inflammation as well. So this herb does a lot. So please keep this in your arsenal when you're treating SIBO. Guduchi, one of my other favorites. Everybody knows this one. It's great for any one of the types. It's a strong bitter, and anything that's bitter, bitter tonic will help us secrete digestion juices, so our pancreatic enzymes, etc. So this is one of those herbs that I probably give to 90% or more of my SIBO clients, or just digestive clients, because it's just so useful. And there are very few adverse effects, and you can give it for a long time without problems. It's been shown to balance the immune function. So now we can kill the bacteria. We can also help the environment where the bacteria lives, which is our intestinal mucosa. If our immune system is balanced and working properly, the bacteria can't thrive, our body can keep them in check. So this herb is doing a couple things. It's helping modulate the immune function. It's helping digest ama, which are the metabolic toxins. It's a bitter, which stimulates our digestive secretions. And it also helps as a cholagogue, which means it helps our bile flow. So, and it's anti-inflammatory. So we have multiple things in this one herbal product. So I find it indispensable in my protocols. Musta, which is Cyperus rotundus, which, by the way, is used in Chinese medicine and Ayurveda pretty extensively in both traditions and for fairly similar uses. And when I see something like that, I just love it because you see a broad array of people around the globe using this herb for the same thing. There's also a North American species, by the way, and native peoples will also use this for GI complaints and pain, similarly to Ayurveda and Chinese medicine, which I find fascinating. So it's a great global herb, actually. So it's great for the inflammation. It's great for pain. It does have some anti-parasitic effect. It's great for that bloating and the stagnation in the abdomen. And then the second model I would like to mention, which is not directly, it's hard to see this sometimes, but there's krimi theory. So krimi are parasites, and this is an ancient theory. And while the pattern, what you're seeing here under symptoms, doesn't always look exactly like what you would see in a client with SIBO, there is some similarity, and there's a lot of talk, at least in the Chinese medicine community, of using theory for krimi parasite theory from the ancient texts for some of the modern diseases that they may not have known or had back then, or just known about because of advances in science, like malaria being a pitta type blood krimi. And so treating malaria with this theory is one of the things we could use, but in this case, the one that looks most similar is the kapha type krimi theory that could apply to this intestinal dysbiosis. So you could keep that in the mind and start looking at parasite theory in the Bhava Prakasha and all these classical texts to see if you can learn some insights for treating SIBO, because I think it definitely has its application. And here's a couple of anti-parasitic herbs from the Ayurvedic Materia Medica. Buttermilk again, of course, but here we put it with garlic, and we'll come to garlic at the end in the Western section as well. You could use Vidanga, and again, you have all the energetics here. I'm not going to read it, but you have to match the energetics, the biocharacteristics, to the person in front of you and balance it in your formula properly. Neem again, we have Balataka. We have patola. Patola is fairly common. It's hard to find as an individual herb, but you can find it in a lot of the formulations if you look hard enough in the Vedic formulations that we have available in the US. And then, of course, you could also think about symptomatic treatments like diarrhea or constipation, and we have some herbs. So for diarrhea, again, there's that pomegranate astringency. We have Kutaja, Horolenia, that's bitter and astringent as well. It could also slow those fluids, sop it up. And Bilva, which is very common. It's really great, especially the unripe fruit of Bilva. The ripe ones work a little bit differently, and they're heavier on the digestion. But the unripe, in small quantities, can help with diarrhea as well. Then for constipation, you have Haritaki, which acts to help as a mild, like a nice moistening laxative. You have Trivert, which is a stronger actual laxative. It's more of a cathartic type laxative. Black raisins, which is something very gentle. You don't know, it's a kind of, you have to think about whether you want to use it or not, because the sugar can also increase the bacteria. So you have to see if it's appropriate for the person in front of you, but you could make a decoction of just simple black raisins to just moisten the bowel, sort of how like in the West we use prunes. And of course, our friend Ajwan, that's just great for that digestive fire, and that could help get things moving along because of its large quantity of volatile oils in that seed. Other herbs that I have that don't quite fit into the categories, but are some of my favorites. We have tree turmeric, Daru haridra, Berberis aristata. This is a berberin-containing plant, and we know that from the research, the Western scientific research, berberin is a broad-spectrum antimicrobial that does not harm the beneficial bacteria, but when the beneficial bacteria is in overload, it can help keep it in check. So it's a wonderful thing to know with a lot of these yellow herbs like Berberis aristata, like Chinese coptis, like golden seal. So some of those herbs have berberin that we could employ as these broad spectrum antimicrobials. Pipili, I love pipili in small amounts because many of these antimicrobials are very cold in energetic nature. And that's wonderful if you have a pitta problem. But if you don't, you could actually damage the stomach fire by giving too many cold herbs. So my trick in formulating when I'm making a formula is I often will add 3 to 5% of pipili into the recipe when I'm putting a formula together, because it does a couple things. It's a bioenhancer because it has piperine. So bioenhancer means this piperine allows all of the other constituents of other herbs in the formula to have a higher absorption rate. So that actually makes the other herbs work better, sort of like a catalyst. And also it's a warming, carminative. So you can protect the stomach fire by adding a warming element in a small amount to all of these cold herbs to create a more balanced formula so you don't damage that stomach, the Jatara Agni, the stomach fire, further. Black pepper is somewhat similar. And by the way, black pepper and pipili have some antimicrobial action, so you're also getting the benefit of that. And of course, our friend turmeric, which, boy, you know, turmeric does everything. It's a bitter digestive, it's a cholagogue, it's antibacterial. It balances and regulates the Th1, Th2 response, which is our immune system. Essentially, it balances our autoimmune to anti-parasitic, basically, that those aspects of our immune system that can be out of balance. So if you have that immune deficiency from all of this bacterial overgrowth, turmeric is absolutely a great part of it, a part of the protocol. Really quickly, we're switching to TCM now. So TCM is probably a little less familiar for you. Essentially, the basic theory we talk about, 5-element theory, is how we start to make sense of the human body. It's our way of understanding. And you can see it with my beautiful drawing on the right side of the screen. Those are the 5 elements, and it's about the cyclical nature of the life, from seed to falling leaves and death, from growth to birth to death. And we have correspondences with each organ to an element. So the earth element, which is what we're talking about today, is the spleen, which is our GI tract. And it's responsible for the emotion of being worrying or being pensive. So Chinese medicine says if you to damage the spleen, you have to be a worrier. That's one of the things. So we have this interrelationship between all of the organs. And obviously, again, I'm very much simplifying this because you can't just treat the spleen. Other things are going to be in balance. But for our purposes, I want to just show you and highlight a few tricks from the Chinese Materia Medica. So we have substances we talk about, just like in Ayurveda. Qi is very similar to prana. Yang is sort of like Agni. So we have the energy of life, the fire of metabolism. We have blood, similar to Ayurveda. We have fluids. We have consciousness. All of these things are similar, just categorized a little bit differently. So the disease that is representative for SIBO from the Chinese kind of classical way of thinking is fuzhang, which means abdominal fullness or distension. And of course, the root of everything is this spleen, which is our GI tract metabolism, qi, which is energy deficiency. So things happen that cause our weakness in our metabolic processes of the digestive tract. Of course, it can be caused by excessive worry or just excessive emotional imbalances in general when we're out of balance emotionally, whatever that means for each individual person, of course. It could happen from other things, just like in Ayurveda, similarly. It could happen from poor diet, untimely eating, some sort of a flu or a cold or something like that could also trigger it, similar to what Ayurveda says. And so basically food and fluid doesn't digest. So it either slips right through and becomes diarrhea, or food and fluid doesn't digest. It stays there, it stagnates, the fluids reabsorb, and you get constipation. So in a nutshell, it could go either way. We talk in TCM in terms of pattern. And these are all based on energetics of how someone looks. And that's where the biocharacteristics come in. So I'm not going to read all of these to you. I just wanted to mention them so that you could, again, have a springboard to start looking into these medicines from a different perspective. You could read about these online. You could find these patterns in books. These are not too hard to find. So what is someone that's spleen qi deficient? I will just mention a couple. Spleen qi deficient is they're tired, they're bloated, they have low appetite, their stool is slightly loose, things like that. So it's your whole digestion is weakened a little bit. Liver invading spleen essentially is I'm stressed, so I create GI imbalances. So I'm sure you'll see some of those people in your career. It's very common. Stress causes GI imbalance. One of the features of this is alternating constipation and diarrhea, where it goes back and forth. Spleen yang is sort of like saying this person's cold, they might be hypothyroid, they don't have enough fire to just get things digesting. Then a couple more. Phlegm damp, it's that digestion's weak, ama or toxins accumulate, so they feel phlegmy, they feel full. You're starting to see the similarities between TCM and Ayurveda, I hope. Everything's just categorized a little differently. Stomach yin. Yin is the fluid that moistens and cools and grounds our fire. So if you don't have enough of these fluids, you get inflammation, things get burned. So you could get some reflux, you can get mucosal damage. And damp heat. sort of like a combination of the fluid plus heat patterns. So of course, we have a vast array in Chinese medicine of different types of energetic and biocharacteristic imbalances. And that's how we look at people. That's how we approach the selection of herbs. So most importantly, let's get to the herbs really briefly. Orange peel. So in Chinese medicine, we have several different types of orange peel, and it's the peel where the yellow, or the white part has kind of been scooped out. And so you're loaded with volatile oils. And what this orange peel does is it stimulates your stomach to produce hydrochloric acid. Excellent stuff. Has antimicrobial properties. It's carminative. It helps get the phlegm out of the body. So it's great for ama, those toxins. It's great for kapha. It's great for cold digestive tracts and mucus in the stool. Another one that's wonderful that you probably don't know about if you're not a TCM practitioner is Baiju, which is Atractylodes in English. Not very common in the West. Absolutely a really big key medicinal. It is great for peristalsis. It actually stimulates peristalsis so we can get the motility back. It's a strong bitter, so it can actually help stimulate pancreatic enzyme release. And it also, it's very drying, so it's great for people with more of the diarrhea type. Da huang, which is rhubarb, not to be confused with the vegetable that you have in strawberry rhubarb pie, but this is a rhubarb root, a type of rhubarb root. That's basically in small amounts, we use it as a cholagogue to stimulate bile flow from the gallbladder. And in larger amounts, it acts as a laxative. So you could use that to help, again, move the motility. It purges heat out of the system. So it's great for people who have a little bit more of that fire type in the intestines, and it balances that. Hemp seed, or it's cannabis sativa, but it's really just hemp seed. So this is the kind you can get in a grocery store, in a Whole Foods. They're just moist, they're slightly laxative, they're sweet, they're nourishing, they're very healing and full of omegas to help heal the GI lining. So these are great for constipation with dry, hard stool. So I use those quite a lot as just part of a food. You know, you can sprinkle them on food, put them in things, whatever you're cooking. Fuling, which is poria. Poria is a fungus, actually, and it's considered a moistening diuretic. So for people who have SIBO where they feel that the fluids are part of the characteristics that are imbalanced, they feel like they're distended with water, it helps as a diuretic. So it strengthens the kidneys to get and makes you urinate more. But at the same time, you're not drying out because the polysaccharides of fungus help to actually lubricate the intestines. So it's also healing to the intestines, and those polysaccharides are great balancing to the immune system. There's one called Glenia. Glenia is a root that we use that helps nourish, and it's also great for intestinal inflammation, for mucosal breakdown. It's cooling to that inflammatory fire in the intestines. This is another wonderful root that you could use as part of your decoctions. And of course, all of these things you could make tinctures out of if they're not commercially available. Not too hard of a process. It's actually a fun process making medicine. Chai hu, bupleurum. I know these are all fancy foreign names, but you'll have them for reference. Take pictures of the slides. Bupleurum is cool, it's immune regulatory, and it's really great for the pain, the cramping, the stagnation in the middle, similar to Cyperus, actually, or Musta, but it acts a little bit higher in the liver and epigastric area. The nice thing about this is it also, because of the immune regulator aspect, it can work nicely for people who have low gut immunity, which you'll find on these tests when you do stool tests, and it's called a fecal secretory IgA. So if you have a low secretory IgA, which means their IgA is their part of the immune system at the tissue level, if that's not up to snuff, you give some of these immune modulatories for the GI tract, and it will help balance those things out. So you could look at the energetics of this liver stagnant, where someone's stressed out and they're knotted in the abdomen, and think, oh wow, chai hu. But then you see a lab test that has a kind of the Western concept of this immune deficiency, and you know that from a Chinese perspective, an energetic perspective, this herb does one thing, but you also know that it does another thing from a Western scientific perspective. In my mind, when you combine functions like that, you get a 2-for-1, and you're really taking the holistic picture into account when you're treating someone. We have our friend dried ginger, which is everybody probably knows. It's great, a carminative. It helps with inflammation. It helps get your stomach acid going, and it's warming. So it's great for someone who, when they feel crampy, they rather have a heating pad on their belly when they have the SIBO symptoms. So ginger is a wonderful thing. And some simple dietary advice. Now, this is, I just said Eastern medicine because it's Chinese medicine, Ayurveda. I'm sure Unani has something similar that I'm not aware of, but they all kind of say something similar. They say, don't eat raw foods, eat lots of warm soups and stews that are easy to digest. Eat 3 square meals a day, no snacking because you overtax your digestive tract. And my favorite saying, of course, eat like a prince for breakfast, like a king for lunch, and a pauper for dinner. Chew, relax. When you're eating, actually eat. Don't watch TV. Don't do other things. Eat mindfully, because that's how we get our secretions to flow. So things like that. Balance the flavors of our food, whether it's 5 flavors or the 6 flavors, but balance the food with all its flavors so that you're getting a diverse array of the energetic qualities and the nutrients that accompany those different flavors. Last but not least, a few more minutes and we'll go to question and answer. I don't want to keep you too long, but Western herbal medicine. Now, Western herbal medicine is actually more than just Western, because really it draws from the global tradition. And you'll even see I put a Chinese herb in there, but I'm thinking it from a Western way sometimes. So that's why I'm calling this the Western herbal medicine, part of the Materia Medica. So gentian, this is a famous European bitter. All of these bitters, whatever one you're looking at, bitters stimulate pancreatic enzyme release. They stimulate gastric HCl, hydrochloric acid. They tend to also stimulate bile release from the gallbladder, pretty much all of them as a category. So even if it doesn't say it specifically on the slide, those all do it. So you could be confident that using a bitter in your formulation is, I think, absolutely part of the protocol for SIBO. I don't think you could have a good SIBO protocol without some amount of bitters in your formulations. So you've got gentian, you have artichoke leaf, and you have Angelica archangelica. That's not Dong Quai, which is Chinese Angelica. This is of the bitter Western or European Angelica. And so you'll notice that most bitters are cold in energy. So if you need a warming bitter because you have more of a cold type constitution or condition, Angelica archangelica is one that you would think of. And one that we've already seen, our friend turmeric, is another warming bitter that you could absolutely consider. So while most are cold, you do have a couple warming bitters at your disposal so that you could always remember to match the energetics to the person in front of you, or we're not practicing good herbal medicine. You have to be mindful of those biocharacteristics. Absolutely. Foundation of what we do. You have carminatives, which are similar. They work on the gastric acids, et cetera. Some of them overlap and have other things like Nigella sativa, black seed. It's warm, it's pungent, it's antimicrobial, as well as being a carminative. Now, of course, remember that many of these herbs have multiple functions. So I know it's hard to separate them out, but I think of black seed first as a carminative, second as something like an antimicrobial, anti-inflammatory, even though it does all of those things. But its most powerful properties, I think, are the carminative aspect of it. You'll see some research that it helps with interleukin 10, and which is strengthens the immune system and decreases tumor necrosis factor alpha, which is part of the inflammation. So it's balancing and immunomodulatory, and it's got lots of good essential fatty acids. Lavender, a very simple flower, is just beautiful. It's great for gas, for bloating, for stagnation, and it's also great for the emotions. So if you have someone that's stressed and they get the stress-induced GI symptoms, this certainly could be an herb that you want to put in their life, whether as a tea or part of your tincture. Remember, though, that if you put too much of it in a tincture or in a recipe, it can act as an emetic and make people vomit. So remember that a little lavender goes a very long way. Our friend fennel, we have fennel, which is great. Essentially, the major thing is it's a carminative that's great for the gas pains. So often more of a symptomatic relief with these SIBO conditions, but it's a very useful herb to just sip as a tea. We could use CCFT, which is cumin, coriander, fennel, or just use fennel by itself. It's certainly active. And then overall, this category of spices, clove, ginger, garlic, turmeric, etc., pretty much all of them have some sort of carminative function. So you could pick the appropriate spice that fits into that particular pattern of, again, of the client's energetics. We have a few antimicrobials. So golden seal is the most famous one, super high in berberine, broad spectrum antimicrobial. bitter tonic. It's also a cholagogue, gets the gallbladder juices flowing. Andrographis, which is called kalmeg or kalamega. Yes, it's an Ayurvedic herb, but in this specific incidents, I'm using it from kind of a Western perspective, which is why I have it here and not in the Ayurvedic section. It's a bitter tonic, it's cold, and probably one of my favorite anti-whatever. It kills bacteria, viruses, funguses, worms, amoebas. It literally can be antibacterial or antimicrobial to anything you've got going on. So I find myself very frequently using this product in many patients with SIBO. Again, super, super cold, super drying. So you can damage the digestive fire if you're not careful, if you don't add the correct amount of warming bitters to balance it, or excuse me, warming carminative spices to balance it out. So even with someone who's pitta, I will actually add a small amount of warming carminatives to balance the energetics of Andrographis to keep their stomach healthy. Thyme, such a simple kitchen herb. Thyme is full of cavacrol, which is one of the phytochemicals, and thymol, which are profoundly antimicrobial on so many different levels. In fact, it even kills candida, which is very difficult, and candidal infections are very commonly comorbid with the SIBO bacterial infection. So this could be one of the tools in your toolbox if you have a yeast and SIBO issue. Oregano oil, which is essentially an essential oil of oregano, of wild oregano or common oregano, either one. It's super hot, super sharp, super piercing. You only need 1 drop of this stuff once or twice a day, and that's it. It's super powerful. But again, it kills biofilms. It helps kill even resistant staph and bacteria that are multiple antibiotic resistant. Wonderful stuff to have in your arsenal. Garlic, you want to remember that to use garlic appropriately or to its maximum effect for its antimicrobial, you take the clove, you put it on your cutting board and you mince the heck out of it until it's really, really fine, spread it out so it gets exposed to the air, and then give it exactly 15 minutes, put a timer and everything. 15 minutes is the perfect amount of time for the allicin to get converted to allicin, which is the major antibacterial chemical. As soon as that timer goes off, you take it, put it in something like either some honey or applesauce or whatever way you can get it down and have the person eat it. If they have a cold constitution and they're okay with those kinds of strong, pungent oils, as long as their stomach can handle it. You do want to be careful to not irritate the stomach and use too much of it, but it's a great trick for killing back some of the bacteria. And one of my other favorites is Huang Qin, which is scoot root or Scutellaria bicalensis. That is a Chinese medicine. But again, I'm using it in kind of a Western way, not in the traditional Chinese sense. So a really great broad spectrum antibacterial, antifungal, bitter, cholagogue. So it does a lot, but it also really shines as an immunoregulator. So we can get that mucosal lining immune system balanced so that our body can start fighting off the bacteria itself. So you've got an indirect and a direct approach to treating the bacterial imbalance with just this one herb, which is really nice to have. So two uses, one herb. Then we've got a slide with a couple of motility agents. Of course, all the bitters help with motility, but very specifically, there's a good amount of research with cloves, which is one of the reasons why why cloves is added to the very famous recipe of avipatikar, which is a Vedic formulation that's a pitta type purgative. It can be used for pitta kapha situations. And clove is one of the major ingredients, along with the trivert, which is the laxative in the Ayurvedic herbs. So you can, even though it's warming, it's just helping the motility so that you can get that fire out of the intestines and purge it out. So clove is really great for motility. It's again, a nice warming carminative. So often this is one of my favorite warming carminatives to add to a formula, either pipali or clove, because here clove adds that motility aspect as well as adding some other broad spectrum antiseptic, antibacterial activities to a recipe. So we're trying to really wrap it up with multiple effects in each herb. Atractylodes, I already mentioned in the Chinese section. That's one of my other favorite prokinetic motility herbs. So I will often use clove or atractylodes in a lot of different formulas with SIBO patients, and then balance it with the other herbs depending on the energetics. You've got your Western mucosal healing herbs, calendula, plantain leaf. Now I will say the note on this plantain leaf is that plantain is only beneficial if it is a fresh product. dried plantain leaf is almost has negligible amounts of mucosal healing function. So either you got to use it fresh out of the ground, or you have to tincture it from the freshly harvested plant. Do not waste your time with a dried tincture of plantain. Not that it won't work at all, but it really is just an inferior medicine compared to the fresh plantain. And this is Plantago major, not talking about banana plantains. This is an herbaceous common plant that grows actually everywhere, at least here in New Jersey. It's a common weed in lawns, which I love because we get to use great medicine all over the place. Licorice, everybody knows licorice. It's just a sweet and very good healing, balancing herb that you don't need very much of it at all to have a really profound effect. And it's great for the gastric mucosa, as well as being an immunomodulatory herb as well. And then there's cat's claw from the South America and Central America. It's great for the bowel inflammation, for leaky gut, for mucosal irritation, etc. And finally, I've already listed all of these herbs in previous slides. That's why I didn't repeat all the energetics. But you have this whole group of immune active herbs. They do other things throughout the presentation. So again, 2 for 1 or maybe 3 for 1 actions. But these are the group of herbs that you always want to remember. We have to repair that immune system as part of our protocols in SIBO. So whether you're using a classical formula or you're making up your own formula, try to pick formulas that have some of these different herbs from all the different categories so that you can make it well-rounded from any perspective. So you could use traditional Ayurvedic medical formulas, but pick some that also have some prokinetics and also have some antimicrobials and also have some immune active herbs. So you're getting the best of kind of East meets West. You're treating it from the traditional energetic perspective, and you're also treating it from the more modern sort of scientific perspective. That's where I tend to work, and that's where I hope you will. And so that's essentially the moral of my presentation. I've got lots of references there for you, so you guys can take screenshots of the recording and have plenty of work to do going over all of these things in your free time. I hope it inspires you to learn a little bit about a new system of medicine or learn about some herbs that you just haven't encountered before. Thank you so much for your time. I'll be happy to take any questions.
Andrew,
I know it was a lot.
Jamie McQuivy. Hi. So I'm kind of looking at the chat here as well as questions. I know those of us who don't have gallbladders, many of us have ended up with SIBO. And so my question for you is, why would you, I swear by ox bile because I've tried bitters, I've tried like ACV, I've tried all these other things. And for me, it's just, I guess I'm not understanding why you wouldn't want ox bile because of how powerful it is.
Yeah, it's a fair question. So in my mind, it's sort of like a drug. It's a very powerful substance you're putting exogenous acids into the body. My preference, now I'm not saying I hate the stuff. I won't say that. I just say, I would say, maybe I should reframe what I said. I would say ox bile is my absolute last resort when none of the other tricks have worked, because my preference as an herbalist is to go to the root of the problem and treat it at the root. So I want to know, why is your organ hypofunctioning? Yes, I know it's because you've had a gallbladder removed. That's part of the reason. But maybe there's some other things you could do to help support the liver produce bile and then get it secreted into the duodenum properly, even though your gallbladder is not there to concentrate it. So you don't have a gallbladder, so yes, it's going to be less effective, but it doesn't mean you can't maximize the function. So, and don't get me wrong, sometimes it just doesn't work. And then for you, the ox bile will work. I'm fine with that. But I would just suggest, try to do whatever you can to try to get your body to do the work before you put the exogenous things into your body. That's just my preference as an herbalist.
Okay, so then would you say there's a step 1, step 2, like the first thing you would suggest saying, yeah,
I would
try this. Okay, so what are your, before you would turn to ox bile, what would you do?
Yeah, I do like the things you've mentioned. So maybe you've exhausted all of those steps. I definitely give people, bitters is always probably one of my first steps. I give taurine, which is an amino acid. Like you saw that in the 5 R's slide. I think some of those things were in there. I might try various bitters of different strengths, because, just a bitters formula, like a classic European old world bitters is one thing, but those are also some of the more mild bitters where we do have stronger bitter herbs that could be used. I also tell people to do things like eat a piece of bitter arugula before you start eating, chew on it, and like let the saliva go for about 20 minutes, 10, 15 minutes before you eat. That could also be a food medicinal trick that you could use before starting eating. And it may not work for you. It absolutely may not. But if you can do those things, you may either be able to stop the ox bile or maybe minimize the dosing of the ox bile so that maybe you're only taking it once a day with your largest meal instead of with, several meals or whatever. That's just it's not a bad, it's just my preference of the way I work.
Okay, so when you're talking about bitters, they're extremely cold. Like I've used gentian before and I actually enjoy it. But like, let's say if you're constitution, you're actually trying to heat up your digestion.
Yeah, so like I mentioned here, we have angelica, which is a warming bitter. We have turmeric, which is a warming bitter. There are fewer of them, but you do have warming bitters. The other trick would be to use you can use the cold bitters, even if you have a cold constitution, but you would add to it warming carminative spices to balance out the energetics so that you have a more appropriate approach for your constitution or disease state.
Perfect. I was just making sure that they didn't cancel each other out. You're trying to get a bitter and a cold, and then you add something like chitrock, like does it cancel?
I don't think they cancel each other out. I just think you have to use the relative balance in your favor. So I don't know, I'm making this number up, but let's say I know that I'm a fire type. I say this to everybody in all my classes, that. So I know that I should not be using a lot of warming spices, but I know that if I have some really good, harsh, like andrographis and really harsh cold bitters, I can put about 25% of my formula in warming materials of medicine, and I'm fine with that. And my body doesn't disagree with my constitution. So you have to find the balance that works for you or the client you're working with.
Perfect. Thank you so much.
You're welcome.
Hi, this is Jaya. Can you hear me?
Yes. Hi.
Hi. See what I had history of GERD like 40 years, and I used allopathy for like 14 years, like Nexium and the metoclopramide, and then I became even worse, and then I started I didn't use anything for like a year or two, and then I started using functional medicine, and then I went through so many types of tests, and then I had methyl positive, and then leaky gut, and gluten sensitivity, and all the sensitivity tests, and zonulin, and a lot of things, and I used Ayurvedic as well as functional medicine for last 3 years, but my I was following the low FODMAPs, and then as soon as I was using antibiotics and the probiotics. As soon as I'm done with all these medications, and then again it was becoming more, and this happened like 3 times, 4 times in the year, 3 years, and then last year it seems like it healed, like I was able to eat some things, and then I feel better with the nausea and dizzy and headache and throw up and all this stuff. But I feel that I don't have any digestion anymore. So last September onwards, like I was not able to eat anything, even though I didn't have the GERD, like not like a lot of acid, but completely I lost the weight and everything. I was not able to sleep. I was not able to eat. That took like 2-3 months and a lot of toll on me. And then by the time like 3 months, I was completely down, and then not able to do anything. So then I started taking homeopathy. Then I started eating a little bit, but still I feel that I don't have enough digestive enzymes and good bacteria. So do you suggest anything that good bacteria to digestion? Still I cannot tolerate lactose, and I can't even eat nuts or anything.
Yeah, so let me go back to the beginning for a second. Okay, so here's the thing that you want to remember. I did talk a lot about antimicrobials and probiotics for sure. I did. It's all about the right balance for the gut bacteria microbiome. But here's the problem. The microbiome didn't become imbalanced for any reason. Usually there's a reason. So in your particular case, now I'm not going to go through your whole health history, of course, on the camera for today, but you have to kind of pin down what is the issue that's causing your system to be imbalanced chronically. don't focus so much on the bacteria immediately, because you can take antibiotics or whatever and probiotics and do all this over and over and over, but as soon as you stop them, things go backwards. So look, go back to the ancient wisdom of these medical systems that I said. What is the emotional state of being that causes your immune system to be off, to cause your digestive secretions to not work? Is the timing of your meals right? Go back to the basics of Ayurveda, the basics of Chinese medicine. Eat 3 meals a day. So instead of worrying so much, in my opinion, about the medicines, focus on the lifestyle and getting that in the right balance. That's what I tell everybody. And it sounds, especially when they have recurrent cases. And so
Yes,
whatever that is for you, it's just something that you're going to have to really contemplate. We're not going to figure it out here on the camera at this point.
Okay. Okay.
You know?
So, but only the question is, do you actually do any consultations that I can, like come for consultation? Because I know it's a long story, but right now, recently, right after this whole 3 months toll, then I got vitiligo. So
Yeah. So I think that's something you'd have to work with. Unfortunately, because I'm a New Jersey licensed practitioner, I can only see people in New Jersey. So
I am in New Jersey.
Okay, then you can find my website, Healthy Living NJ, and we can set up an appointment. I don't want to discuss personal items too much on it. I want to talk more about the SIBO presentation tonight. Okay.
Yes, this is SIBO. See, I have SIBO too. I had SIBO.
Yeah. So we can get in touch if you're interested in that. But does anybody else have any other questions about the presentation materials or the herbs? Let's focus more on the herbs if we can.
Or the herbs also, like I was using for 3 years. I did meditation, yoga, and all these things. I'm like trying to calm down, and I like so much anxiety gone down, and everything is good. But suddenly this happened, and then that's why I don't know whether it's improving or going bad. That's very much worrying for me.
Just go
How
back.
do I come to know your contact information to consult you?
Right there on the screen.
1 second, please hold on.
Okay. Any other questions from anybody else? Yes, Kim?
Yes, I just have a general question. I've been through this process before, and I'm just curious. You talked about in the beginning with the functional medicine approach of removing and then rebuilding the system. Is that still the case with all the different styles that you presented? To focus on removing, or can you do kind of rebuilding the gut lining at the same time as the treating of the bacterial?
So first of all, even with the functional medicine approach itself, all of those things are typically happening simultaneously when you're treating. So those 5 R's are to remind us as practitioners to make sure that we keep our mind addressing all of the big picture items of those 5 R's. So we are removing things with antimicrobials while at the same time trying to rebuild the population that we want of bacteria with probiotics, and healing the gut mucosa and helping the immune function. We're trying to layer on multiple aspects with every protocol we do. And you could do that with classical Ayurveda. You just have to find the particular formulas that do those kinds of things in Ayurveda. You could do it with classical Chinese medicine. You could do it as a hybrid using different things, which is what I tend to do. That's totally up to you. But it's just a way of thinking, I think. And you can do all of them at the same time, sure.
Okay, because I was treated sequentially before, so I didn't know if that was still a thing or not, or if people are just treating it kind of more holistically.
I think we have to take it on a case-by-case basis. I don't think we can make a definite rule, but my personal preference, I'm typically doing all of those at all times with all SIBO patients, except for that one thing I mentioned where sometimes I will wait on the probiotics and the prebiotics because I've run into problems with giving those people prematurely. And if you think about it, if you already have a lot of extra bacteria in your intestines and you put more bacteria in, yes, in the long run, that might be great because you're getting the right bacteria, but it's still too much for someone to handle comfortably in the initial phases. Other than that, I pretty much do everything simultaneously.
Okay. All right. Thank you so much.
Sure. And I'm sorry, I haven't been looking at the chat because I can only see my PowerPoint slide. So if you wrote a chat question, please come on camera and say it because I'm not monitoring it very well.
Do you take phone consultations from Canada?
I do not. I'm so sorry.
Okay.
Yeah, sorry. Silly laws, I'll tell you. They prevent me from
Right.
doing a lot of good stuff.
Okay.
I know we went through a lot of material, so if you have any questions, I'm happy. I have a few more minutes. I know, John, what time do you want to finish this seminar, the session up? It's up to you. Liz, you have a question?
I wanted to follow up on your comment about the sequence and the pro and the prebiotics. So if you give someone a probiotic or a prebiotic and they get a lot of gas, back off, right? And go
Correct.
ahead and treat the microbes, then maybe treat the gut a little bit and then introduce. That helps me so much because people hit a wall and then you're sort of lost, but it makes so much sense. So thank you.
Absolutely, 100%. And you know what? I love how you said that. The patient, the person in front of you gives you the best information you could ever need. What we really need to focus on is listening to the people, what they're saying, and not just what they're saying in words, but what their body is saying, what their tongue is telling us, what their pulse is telling us. All of those different things tell us how to change and make our little maneuvers to be good herbalists for that particular person, because everybody we see is going to be individual, very unique.
Yeah.
So yeah, absolutely.
Thank you.
Thank you very much, Andrew.
You're
It
welcome.
was great presentation, lots of information. We will send out a recording so that people can access some of this information. As Andrew said, take screenshots where you need on the recording, and then you can look up that amazing reference list. I can't wait to check out that reference list. And also just the list of herbs, list of different Chinese medical syndromes. As you know, Andrew, my background is in Ayurveda, so I'm always looking to see how Chinese medicine approaches things and integrating it in with the, Ayurveda methodology. And also what I found was really awesome was seeing some of the same herbs looked at from several different perspectives. Kalmeg, Andrographis, Atractyloides, other herbs that you were looking at them from the TCM perspective, from the Ayurveda perspective, and then also from the Western herb perspective. So you really get to see the differences between some of those approaches. Yeah, so even just getting a feel for how these different systems approach it. Chinese medicine looking at the different organ functions and also looking at outcomes, and Western herbalism looking at herbal actions, right? Like there's an outcome based approach and an herbal action based approach. So it's not just that you're listing different categories when you're doing TCM versus Western herbalism, but even different kinds of approaches or kinds of categories, outcomes versus herbal actions. So that is interesting to see that as well. So Andrew, again, I just want to appreciate your level of knowledge and your level of clinical experience. I'm sure everyone here is hungry to do a consultation with you because they know that it's going to make them help them feel, wonderful. And so I just appreciate you giving so much of yourself again and all that you do. So with that, we'll let everyone go. Have a wonderful evening, everyone. Thank you again for your interest in health, for your interest in digestion and SIBO, and also for coming to the American Association of Biocharacteristics Clinicians. Look forward to our next talk. Stay tuned, and we give talks every few months, and so hopefully we'll see you again. Take care, everyone.
Thank you, everyone.
Thank you.